everyone to this week's Rotary Club of Madison online meeting. I'm Andrea Kaminsky, Club President. I hope you like my stylish face mask, which my neighbor Maria kindly made for me. I also hope that all of our Rotary members are doing what you can to protect yourselves and your neighbors from the coronavirus. But actually, I'm in my own home, and it's a lot easier to talk without this. Now, just before today's meeting, we had a small group of members enjoying a virtual coffee get-together on Zoom. If you'd like to sign up for next week's online coffee time, contact the Rotary office and let them know. They'll get you all set up. As usual, I'd like to remind you of the Rotary four-way test of the things we think, say, and do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Those are truly wise words in these times. Now, we have a few announcements today, beginning with Doug Dittman, who chairs our Philanthropy Committee. Doug?
Thank you, President Andrea. In this time of challenges and setbacks as we deal with COVID-19 pandemic, I wanted to share some happy news. You probably read in our Rotary News a few weeks ago about the $204,000 we are distributing in community grants to 55 local organizations. We can all be proud of our ability to make these grants, especially at a time when local organizations need extra resources to help an increased number of families in our community. Our thanks to Neil Heinen, who last Thursday gave Rotary a nice shout out about our efforts as well. Starting this year, our Madison Rotary Foundation created a small fund to enable us to provide emergency grants for needs that arise outside of our regular funding cycle. I serve as chair of our club's Philanthropy Committee, which we oversee this new opportunity fund. Our committee recently reviewed and we recommended using this fund to help with the increased number of families seeking food and basic supplies during this pandemic. I'm pleased to announce that in addition to the 55 community grants we are distributing, we are also providing $1,000 each to the three largest food pantries, which are Middleton Outreach Ministry, River Food Bank, and Society of St. Vincent de Paul, as well as Second Harvest Food Bank, which is helping supply food in our community. Our club is also applying for a matching grant from our district and hope to receive an additional $1,000 for each of these organizations as well. We are also seeking Rotary volunteers to help with packing meals for these organizations, and please contact the Rotary office if you would like more details. I hope everyone is staying healthy and safe, and I'm pleased to be delivering this good news to members. Take care, and thank you.
Thanks for that wonderful news, Doug. And now Martha Sullivan, who serves on our Community Projects Committee, has an announcement. Martha?
Hi, everyone. This is Martha Sullivan, and I am checking in from the Community Projects Committee. We wanted to make you aware of a project that we have going on right now, and there are a couple of ways in which you can participate. The first way is if you are a sewer. The project is focused on making non-medical grade face masks made out of 100% cotton. And the template that we have been using, or I should say I've been using, uses hair ties as opposed to elastic for the ears. There are other templates out there as well, which are welcome. But ultimately, it comes down to we're looking for Rotarians that have sewing skills that would be interested in helping us make masks for our fellow club members as well as our community, which is the second way that individuals can become involved. First off, as a Rotarian, if you would like a cotton mask for yourself or your family members, within reason of numbers, but if you would like a cotton-based face mask, email the home office and let them know. The masks will be available on a first come, first serve basis. And we will work to figure out how to gather them up and get them distributed to everybody safely. Secondly, if you know of organizations that may be in need of such masks for their frontline workers that, again, are not medical, let us know that as well. I myself will be making this weekend masks for River Food Pantry, and I know that through conversations with Marsha Whittington that Grace is looking for approximately 100 to 150 of these masks. I'll be able to fill some of that need, but certainly not all of it. So that's where the call for sewers is important, as well as other organizations we know that are out there that may be needing masks and don't have a resource for them. If you are a sewer and would like to participate, email me at msullivan@honcamp.com, as I will be trying to coordinate the communication and sewing core, if you will. And then also, if you have materials, if you have 100% cotton that is what was referred to as quilting grade or quilt weight, that is the caliber of fabric we're looking. If you have stashes that you want to contribute, we would welcome those, as well as if you have stashes of the thin elastic and or unused clean hair ties that you can contribute to the cause. Let us know that as well at the Rotary office, and we can coordinate collecting the supplies to make these masks as well. So I think that covers it. I hope you are all staying safe. I look forward to seeing you guys in the very near future. Thanks much.
Thank you for that timely announcement, Martha. Now we have birthdays to celebrate. This week's members are George Keene, Ned Baxter, Mike McKay, Craig Weddell, Chris Ash, Ellen Foley, Donna Beastman, Rebecca Paré, Haley Salsa Miller, Dean Nelson, Phil Levy, Becky Steinhoff, Gary Peterson, Scott Strong, Martha Sullivan, and Christine Euclid. We wish all of these members a very happy birthday, and we thank those who made a contribution to our Madison Rotary Foundation. Let's sing Happy Birthday.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Rotarians. Happy birthday to you.
We held our monthly board meeting on Zoom on Monday, April 6th. That was our club's first ever virtual board meeting. I encourage members to review the minutes, which are posted on the member login section of our club's website. Now, we're continuing to ask one board member each month to introduce a speaker. This month, board member Lynn Sexton will make the introduction. Lynn is Chief Executive Officer of A Grace Hospice Care. She joined our club in 2013, and she is currently serving her first year of a 2-year term on our board. So I'll turn it over to Lynn to introduce our speaker.
Thank you, Andrea. Today's speaker is Lynn Brady. She is the president and CEO of Journey Mental Health Center. She holds a bachelor's degree in psychology and a master's in public health administration from the University of New Mexico. She has more than 30 years of experience in the mental health and substance abuse field, both as a clinician and as an administrator. Lynn has been a member of Rotary since 2017, and today she's going to be talking to us about dealing with mental health in the time of the coronavirus, which I think we all would agree is a very unique national emergency. So please join me in welcoming Lynn as our speaker today. Take care.
Good afternoon. How are you doing? Is this social distancing wearing a little thin with you? Wouldn't you just love to be at the Park Hotel having a piece of salmon and listening to somebody interesting talk about something today? I know I would. But instead, we're keeping apart. But I have to tell you, this social distancing is going to have an impact on the mental health of us all. We are just social creatures by nature. We like to get together. We like to do things together. And isolating, distancing at this level of intensity is going to have an impact because it just doesn't feel natural. And then there's the uncertainty of when it's all going to end. Will this stay-at-home order be relinquished on April 24th, on April 30th? Will it go until the end of June? We don't know. And then will this virus return in the fall? We don't know that either. So all of this stuff together is going to increase our stress levels. I really hope that as you hear my presentation today, I can present something that will help you and the ones you love get through this situation. So when I was asked to do this presentation today, I was asked specifically what kinds of calls we were getting from the general population. What kinds of services were they requesting? What was it exactly that they were needed that was directly related to the coronavirus outbreak? And the truth is that at this point, we're just not seeing a lot of calls from people who are requesting treatment. What they are requesting is help with certain particular things, such as tips on how to deal with stress, their own stress and the stress of others in their lives. Questions on how to talk to their children about this. Questions about how to reach out to a mental health professional if they do feel like they need one in the future. And we're hearing from mental health professionals who are saying, I need a place to talk about the stress that I'm feeling as I'm working with others that have mental health issues. And we've had some offers of help, which is always really great when people call and offer to help. So I thought we might start by just talking a little bit about what is mental health? What does it mean? We know, I think most of us, that it's an important overall component of our whole health. If our mental health isn't good, we aren't going to be feeling good physically. And it's not just the absence of a mental disorder. Okay? We are all right now experiencing worry and fear. That doesn't necessarily carry a diagnosis, but it also doesn't mean that we get a clean slate when it comes to our mental health. And we have to remember that mental health is impacted by biopsychosocial determinants. And if there were ever a time that was true, it's certainly now. This epidemic has caused us to have our entire social structure uprooted. We're not going to work. We're not going to school. We can't participate in social gatherings. So it's really having an impact on our biopsychosocial life. Think about when the pandemic first hit home, and I mean here in Wisconsin. We've been hearing about it, but it was far away. Now it's here. So we started out worrying about the increasing numbers of cases. There was one or two people who came back from outside of the country, and then suddenly there were more, and then more, and more at an increasingly rapid rate. And then we began to realize that there was social passing, that people were giving this to one another in our community. And that put a whole new picture on things. We have increased feelings of anxiety and fear related to our family and friends as a result of this, as a result of community spread of the disease. Schools are closing, and that impacts kids and families. Stay-at-home orders just added a whole new level of stress to this, with many people worrying about their jobs, worrying about the jobs of their coworkers, their partners, their friends, their families. And then there was the whole issue of purchasing behaviors that had an impact on the ability of supplies that all of us needed and suddenly couldn't find, and concerns about whether it was safe to go in a grocery store or to do what we needed to do in our activities of daily living. And everyone reacts to stress differently. Adults act one way. Older people and people with chronic health conditions react another. Children, of course, have their own unique set of issues. First responders and other healthcare providers are dealing with what we're all dealing with on a personal level, and then dealing with what they're seeing when they go to work every day. And people with mental health concerns, of course, have a difficult time coping with the additional stress. So there are some general signs of stress that you can see across the board. Fear and worry about your health and the health of your loved ones is something that I think we can all see in each other. We might find that we or others have changes in their sleep patterns, not being able to get to sleep at night, not being able to stay asleep, sleeping too late in the morning, or changes in eating patterns, overeating, having a loss of appetite, consuming too much comfort food. And then there's worsening chronic health problems. People with high blood pressure because of the stress and worry may see their blood pressure go up. People treating their diabetes may find that they're not doing everything they need to, or the stress is having an impact on what they are doing. And many times the way people will self-medicate or take care of themselves around these issues is to increase their use of alcohol, tobacco, and other drugs, which brings about a whole set of concerns in and of itself. Older persons and those with disabilities are at increased risk for mental health concerns during a pandemic like this, particularly when it comes to depression. But I think it's really important to realize that depression can present itself in ways that go further than just looking sad or maybe being withdrawn. That sometimes these problems can manifest themselves in physical ways, people complaining of headaches, stomach pain, memory problems. So it's really important that if you know somebody that's older and somebody that's dealing with a chronic health problem or a disability, as well as this pandemic, talk to them. Try to tease out what could be the depression, what might be something else, and certainly involve a healthcare professional, mental health professional, if you feel that you need one. And be careful not to interpret depression as just a result of aging during this pandemic, because it can be very much situational to the outbreak of the virus and all that's going around while we're living in isolation. With children and adolescents, are going to take their cues from their parents or the other adults. So it's really important that as their primary adult person, we be calm and we be confident and we be informed and ready to talk with them about what is going on. You might see irritability or excessive crying in younger people. You might see a return to behaviors that they've outgrown, such as bedwetting. You might see acting out behaviors, especially in teens who really are going to react strongly to this isolation. Again, you may see that there are unexplained headaches or body pains in kids that are a result of the stress they're feeling because of what's going on with social isolation. And again, also changes in sleep or eating behaviors, and particularly difficulty concentrating or paying attention because they're lost in thought and worried. So how do we manage stress? First and foremost, during this pandemic, it's important that we take breaks from the news. When I watch the news for longer than an hour, I probably see 3 or 4 updates on how many people have come down with the illness today and how many people have died locally and across the country. That's not something you need to be listening to over and over and over. So be sure you're getting breaks. Get informed from good news sources, but be sure you're taking breaks. Take care of your body. Eat, sleep, exercise. Make a schedule for yourself. Get up at the same time every day. Take a shower. Have a routine that you're going through. Keep yourself engaged in activities that you enjoy and activities of daily living. Play games, watch movies, read books, garden. Think of the positive side. There's so much we can do during social distancing. It doesn't have to mean total isolation. Talk to your neighbor over the fence. Interact in any way that you can. Connect with others. We're so lucky to have texting and Zoom. We can always pick up the phone. You remember that antique. Social media is a great outlet. Talking, as I said, to one another over the backyard fence. Be sure that the information you're getting through social media is legit. Set goals and priorities for each day and focus on the facts, both for you and your family members. And the facts are that this disease can make anyone sick, regardless of their race or ethnicity. Don't be afraid of people because of who they are. It attacks everybody equally. Follow social distancing guidelines and you will be safe, even if you're in a high-risk category. And there are high-risk categories. But if you're washing your hands, staying at home, social distancing, keeping away from others, and reducing your risk of contacting the virus, you're going to be fine. Don't be afraid of people who have had the virus and recovered. If they have no fever, no symptoms, and they've recovered from the virus, they are safe. And remember to do the things that have been repeated to us over and over and over for the last couple of months. Wash your hands, don't touch your eyes, your nose, your mouth. Stay home, cover your cough and your sneeze. And if you have any symptoms, fever, cough, shortness of breath, seek medical advice immediately and follow your doctor's orders. So how do you help children cope? We need to be calm and reassuring, as I said earlier, confident and sure of what we're telling them. We need to be available, and we need to listen, and we need to talk to our kids. And let's not underestimate the feelings of loss and grief that they're having. They're not seeing their friends. Their sports events that they were going to watch or participate in have been canceled. If you're a senior in high school, you've lost your prom and graduation. And then there's the inability to gather in the kinds of venues that give us comfort, our synagogues, our churches, our mosques. We can't go there and be together and get that comfort that they used to get. Avoid language when talking to your kids that may sound like it's blaming others. This is the coronavirus, not the Chinese virus. Help your kids understand how it spreads and what it does and how it can be controlled. Give honest and accurate information because we know our kids are seeing a lot of inaccurate stuff on social media. And teach those same safety precautions that we are all supposed to be practicing. So what about leadership during a pandemic? As Rotarians, we tend to be organizational leaders. Some of us are leading entire organizations, others large chunks of organizations. And some have been faced with some very difficult business decisions in the last month or so. And these can involve anything from laying off staff to closures of your business. So we have to exhibit strong leadership skills while dealing with the same fears and concerns as our workforce. We need to be sure that they're feeling confidence in us and understand that we've got this and are working in their best interests. So some of the ideas for coping as a leader that we have adapted at Journey a couple of weeks before the stay-at-home orders, and when we were just beginning to talk about COVID here in Wisconsin, we created an emergency preparedness team to get ready. And we spent a lot of time getting ready in that early initial part of all of this. And once we had stay-at-home orders and schools were closed, this preparedness team became even more important. We did things like make sure we had protective clothing for our staff, masks, shields, gloves. We have a lot of staff that still go out into the community. They give injections, they deliver medications, they see patients up close and personal, and we wanted to be sure that they were protected. We deal with all of our HR issues and accounting issues at these meetings. We deal with systems issues and talk about other programs that are providing similar services and how we can work together and collaborate, and what do we have that they need and what could we use that they have. And we basically deal with our organizational resources. We meet daily so that we know every day we're on top of this, and it gives us contact with each other and increases our confidence that we know what's going on. We are keeping in touch with our workforce using our electronic newsletter that goes out every other day. Every Friday, I make a video that goes out to all staff in an all-staff email. I try to focus on the successes that Journey has seen during the week, presenting the positive parts of everything that we're doing. And I also try to present what we're struggling with. Here are a couple of things we're struggling with. Here's how we think we're going to approach this. And here's what you can look forward to next week. Hopefully, as problems come up, we're getting them solved. Set up a system to answer questions from your staff. Our staff have, we have hundreds of staff, and they have hundreds of questions. So we created a central info mailbox, and they can email their questions there. And we have a central info team that meets at noon every day. We go through these questions, we answer them. If we can't answer them, we find the subject expert person that can, and we get an answer, and we get that answer posted in a place where all staff can see it. We are also sponsoring support groups for our staff so they can talk about what their experience is. We're calling these sharing the weight, and it's sharing the weight of working in the field of mental health during a pandemic. And we encourage all of our staff to participate in these groups. And we've had great turnout, and people have really appreciated the time we've taken to set them up. Remind staff that mental health professionals are available to help. And I recommend that you check with your commercial health provider to find out how to contact. So we're trying to look to the future. Remember Dr. Fauci's words. He said, we don't control the virus controls the virus. And so we're really taking that to heart. And we are looking at the long-range plan. We don't know if stay-at-home is going to be enforced until April 24th or April 30th. And so we're going with the June 30th date. We're going to plan far out. We're going to develop a long-range plan. And as we get closer, hopefully we'll be pleasantly surprised and it will end. If not, we'll have made that long-range plan and have it in place. And if we have to extend beyond June 30, we'll be prepared to do that also. Be prepared to see more mental health issues as time goes by. Depression, fear, anxiety, these things are going to become more prevalent the longer we have to practice social isolation. And remember, there are mental health professionals here to help. Discuss coping skills with your staff. The ones presented here, the ones you're using, ask them to share the ways that they are coping. Be sure you're in touch with them and talking about this stuff on a regular basis. And be in touch, again, with your organization's healthcare provider to facilitate referrals. Be sure that if your staff reaches out to you, you know how to let them know how to contact that healthcare provider to get the mental health support that they need. And use your EAP whenever it's possible. So I'd like to just give a couple shout outs and some special thanks to the National Institute on Mental Health, the Center for Disease Control, the World Health Organization, and the Substance Abuse and Mental Health Services Administration for the generous and unlimited use of their resources that are designed to help educate the community. And remind you that if you or someone you know is having a severe mental health crisis, please reach out to us. Please call the Journey Mental Health Center crisis line at 280-2600. This line is staffed 24/7, 365 days a year with professionals that know how to help you. I hope you found something of value in today's presentation. I know that a lot of it sounds like good old-fashioned common sense, but you'd be surprised at how many times people don't follow the recommendations, especially in times like this when there is a national crisis going on. I would also like to take just a minute to give a big shout out to the social workers, the counselors, the psych nurses, and the psychiatrists that are out there every day during this crisis with boots on the ground, continuing to provide services to people that have severe and persistent mental illness. These folks are providing medications, they're giving injections, they're making sure that the well-being of some of our most vulnerable citizens is being seen to on a daily basis. And I think as a community, we need to all give them a big round of applause. So please, next time you see somebody in the mental health field, thank them for what they're doing. Thank you for listening. Please be safe, stay well, and keep apart. See you soon, I hope. Bye-bye.
Thank you to Lynn Brady for sharing that very important message about identifying and dealing with mental health issues during the pandemic. A reminder to members that you can rewatch this video or view past speakers on our club's YouTube channel. And you'll find a link to the YouTube channel on the homepage of our website. So we are adjourned. See you online next Wednesday.